I saw what a whole society being ravaged by measles will look like, and it's not pretty.
The measles death toll in Samoa is now 62.
A national emergency has been in place since last month, closing all schools, banning children from public gatherings.
It was chaos, a lot of confusion.
It's broke me to a million pieces.
Hi, darling. Hi.
Because she's my first child.
We don't know what was killing them.
He's trying now to play down his role in Samoa. That's not what the parents say.
From my standpoint, should rot in hell for this.
His presence in Samoa was significant for the anti-vaxxers.
Measles cases here in the U.S. are at their highest in 3 decades.
It's a big problem, and it's a very concerning problem.
You will be shocked. I know a whole lot more people whose children are partially vaccinated or completely unvaccinated.
The Atlanta-based Centers for Disease Control and Prevention says the U.S. has reported nearly 1,300 cases.
I mean, from my point of view, I just want to protect your child.
Why should people in Georgia, the United States, care what happened in Samoa?
Because it could happen here. It could very much happen here.
Hello, I'm Atlanta News First investigative reporter Andy Parati. We come to you from the island nation of Samoa, more than 6,000 miles away from Atlanta, to talk about a rising public health crisis in Georgia and across the United States. Samoa faced one of the deadliest measles outbreaks in the world in 2019, where dozens died, most of them children. Experts say learning how it happened here could save lives everywhere. But first, we return to Georgia to examine the potential causes of declining vaccination rates and the ripple effect of misinformation.
Come give me a hug. You haven't seen me in days.
Hi.
This place had the most delicious cookies. Oh, y'all need to try the peach. Y'all need to do the peach. You like it?
The smell of new cookies fills the air in the Slaughter family kitchen.
How many have you had? No, you can't have 5.
A treat for Mariana's 3 children who are used to eating organic.
Our candy has to be natural. They're all natural herbal supplements. No pharmaceuticals here.
Mariana says her children have never taken medication, not even over the counter, and none of them are vaccinated.
It was a hard decision. It was a decision that I struggled with, but at the end of the day, I did the research. I weighed the benefits and the risk for our life. It just was not something that we were willing to take the risk for.
Her decision based on her Christian faith and her belief vaccines impact immune systems.
And I don't hide my children in a hole. So if we're out at a playground or at a grocery store or in a restaurant, they're exposed to life. I don't protect my children. I want them to be strong, both in their social skills, in their intelligence, and in their immune system.
Mariana represents a growing number of families in Georgia and across the country not vaccinating their children for measles and other preventable diseases. According to a Johns Hopkins University 2025 study, vaccination rates for measles, mumps, and rubella, or MMR, have dropped nationwide since 2019. 78% of counties reporting declining immunizations.
Another case of measles has now been confirmed here in Georgia. We're told this patient is...
And public health officials say the declining vaccinations contributed to the worst measles outbreak in the U.S. in 3 decades. According to the Centers for Disease Control and Prevention, nearly 1,300 people contracted the disease in 34 states by summer 2025. 2 children died, 1 adult, none of them vaccinated. Most of the cases in the South.
We now know a second child has died from measles in Texas.
Jody Guest is Senior Vice Chair of Emory University's Department of Epidemiology.
It is incredibly sad, particularly when we've seen kids die of measles. This is a preventable illness and one we should not be seeing kids die from.
A new study released this week finds the U.S. could face millions of measles cases in the next 25 years if routine vaccine rates continue to go down.
Only 11 states last year achieved the 95% vaccine rate, and kindergartners needed to achieve herd immunity. Georgia is not one of them.
The rate of vaccination here in Georgia is too low to fully protect against the spread of measles, they say.
What goes through your mind when you hear that?
It's unfortunate that we need to do a better job of talking about these vaccines and why they are important, that we need to be able to answer people's questions about it. People should ask questions about vaccines, and we need to meet them where they are and talk about those questions.
Dr. Roy Bennerock gets a lot of those questions. As a pediatrician in Roswell, Georgia for nearly 30 years, measles, he explains, is a viral infection impacting mostly children. Symptoms include high fever, cough, and a rash that typically travels from the forehead down.
It's also the most contagious illness we know of. Very, very easy to catch measles. The air in a room, let's say this room here, this exam room, if there was a child with measles here, then the child is taken somewhere else, the air in this room will remain contagious for about 2 hours.
Measles is rarely fatal, about 1 in 1,000 cases, according to the CDC, but about 25% of children who contract it are hospitalized, and it can lead to a brain disorder down the road called subacute sclerosing panencephalitis, or SSPE.
Unfortunately, if your child does come down with SSPE, it's much later, 5 years, 10 years after measles, and the brain just degenerates, and the children will lose all of their abilities and fall apart in front of your eyes and die. There's no treatment possible for SSPE. Not common, but entirely preventable. I really think parents want their children safe and loved, and they don't want to worry about it. But unfortunately, in the minds of some people, there's developed a lot of distrust. And from my point of view, I just want to protect your child.
Public health officials say that distrust is fueled by social media. According to a 2025 survey released by KFF Health, a nonprofit focused on health policy, measles misinformation is on the rise, revealing that Republicans are twice as likely to believe the measles shot is worse than the disease. And critics say the person responsible for spreading some of the anti-vaccine views, the country's highest-ranking health official, U.S. Secretary of Health and Human Services, Robert F. Kennedy Jr.
There are adverse events from the vaccine. It does cause deaths every year.
Some statements completely untrue.
That if you take the vaccine, you have a 21% increased chance of dying over the next 6 months. But I take this obligation freely.
Since confirmed as the Secretary of HHS this year, Kennedy has shared mixed messages about the safety and effectiveness of the MMR vaccine. Here's what he told members of Congress in May on the same day.
This isn't a gotcha, I promise. If you had a child today, would you vaccinate that child for measles?
For measles, probably for measles. What I would say is my opinions about vaccines are irrelevant. I've said that the best way to stop the spread of measles is through vaccination.
Are you recommending the measles vaccine or not?
I am not going to just tell people everything is safe and effective if I know that there's issues.
It sows distrust. If a leader of your Health and Human Services does not have a consistent message about how we have studied rigorously vaccines, how they work to prevent illness in you and the people that you love, when you hear flip-flop messaging, it consistently brings up more questions for people.
Georgia Peach.
Mariana calls Kennedy a godsend.
Because he hears us. He listens. I think that he has always believed in the freedom of choice.
So it doesn't bother you that he's kind of wishy-washy on the answer?
I really don't care what he says. I care what he does.
But it's what Kennedy has done in the past that has public health officials worried about the future.
From my standpoint, should rot in hell for this.
Including his alleged involvement spreading misinformation a world away. where dozens died.
I want to tell you what he did in Samoa.
Samoa.
In Samoa,
I went there, nothing to do with vaccines.
He's trying now to play down his role in Samoa.
Just pure shock and sadness.
And ladies and gentlemen, from the flight deck should be airborne momentarily.
We're on our way, halfway around the world from Atlanta, to investigate a deadly outbreak on a remote tropical island in the Pacific. A story made possible with support from the Pulitzer Center. Here we are. To understand what Georgia and the United States can learn from mistakes of the past. Elsie Fa'ata U'u'u talks with her father about a beloved grandchild.
Hello.
Her daughter, Noelle Lolesio.
Hi, darling. Hi.
You see her? She's healthy.
Yeah. Shortly after recording this video in 2019, the 1-year-old got sick. It started with a fever, and then it got worse. The 24-year-old mother never took her daughter to the doctor.
Because I see her healthy, and I think, oh no, she's healthy. Yeah. She's fat. It's okay.
Yeah.
I think if I get her to the hospital, she might getting worse.
So you were scared about bringing...
I'm scared. I know, I'm scared.
Frightened because Samoa was in the midst of a deadly measles outbreak ravaging the country.
The measles death toll in Samoa is now 62.
A national emergency has been in place since last month, closing all schools, banning children from public gatherings.
2 to 7 people are passing away every day.
For Avaso Tu'ivale's family's loss, unthinkable. 3 children, a little girl, and 6-month-old twins, all victims to the measles, all of them buried in her front yard, a common practice in Samoa.
I think back to what happened, it just breaks my heart. It's hard because the children were mischievous. Their unique traits make them unforgettable. Even now, I try to forget, but it's still difficult.
The disease did not spare Elsie's daughter either.
And we don't need to see them die. That's what I see to my daughter, and it's broke my heart. It's broke me to a million pieces because she's my first child.
Samoa is made up of 9 islands in the South Pacific, the closest continent, Australia, nearly 4,000 miles away. A deeply Christian nation of about 200,000 people, around the size of Augusta, Georgia, and a history of mistrust in Western medicine. About a year before the outbreak, on July 6, 2018, 2 Samoan children mysteriously died within hours of receiving their measles shots. The country temporarily suspended MMR vaccines until they uncovered what happened. But authorities say these 2 nurses knew. They administered the vaccine with a deadly mix of expired muscle relaxant. Both were sent to prison. Vaccine rates were already low, but the infants' deaths made it worse, says Dr. Robert Thompson, Deputy Director General of Samoa's Public Health Services.
Well, it really shook the trust of the people of the system.
About a year later, Samoa got its first confirmed case of the measles on September 30th, 2019. Public health officials suspect it came from someone visiting from New Zealand, experiencing an outbreak of its own. During that time, thousands were visiting Samoa from across the globe for the Pacific Games, a regional sporting event, and a religious conference. Within days, the disease spread like wildfire. It sounded like it was a recipe for disaster. You had
Yes.
low coverage, low confidence, and you had a lot of people visiting the island at that time.
Yes.
And then, bam.
Bam, yeah. In a matter of 2 weeks, the numbers just went from 0 to thousands.
In 53 days, cases jumped to 1,600. By January, more than 5,000.
And the only way that we can best tackle the problem was to push the vaccination levels up.
Within weeks of the outbreak, nearby countries like New Zealand and Australia sent medical teams to aid in the response. And so did the United States. And we're on our way in Hawaii to interview the person who led the charge, Hawaii Governor Josh Green.
When we got to Samoa, there was measles everywhere, and people were dying and overflowing the hospitals.
Very fast. During the 2019 outbreak, Green was lieutenant governor. He's a long-time emergency room doctor. Green chartered a plane to Samoa with nearly 70 doctors and nurses. Families who needed vaccines placed red pieces of clothing outside.
But those red sashes, or the red ties, the ribbons, on houses everywhere we looked, that guided us. It was right out of the Bible, because the people knew that they had, in this case, to somehow defeat what was taking their children.
Dr. Villasigo is a pediatrician in Hawaii who volunteered to join the governor's team.
There were a lot of red flags because people at this point in time were scared. I mean, I don't know what happened before, but at this point in time, the population is scared and very willing to be immunized. There's no cure for measles. Measles runs its course, so it's all supportive therapy. So you have to just watch and wait.
By the time medical teams finished its mass vaccination campaign ending the outbreak, 83 people had died. The majority of them, children. New Zealand sent child coffins when Samoa ran out. Elsie's daughter buried with her cousin who died from the disease too. Their grave below our feet.
Because here is my home. So whenever I come back home, then I see her here. I feel like she's here. She's always with me.
Why should people in Georgia, the United States, care what happened in Samoa?
Because it could happen here. It could very much happen here.
So you're going to see the same thing in rural Georgia and rural Texas and rural Hawaii, New York, anywhere, as you saw in Samoa, as vaccine rates plummet. You will see outbreaks.
Families broken by loss, they now know could have been prevented. What's your message to Georgia, where I'm from, and the United States?
So please, just begging every parents in America, please get your child to get a vaccination.
Samoan public health experts say something else was catching fire before and during the epidemic: misinformation.
It absolutely killed children. It devastated public confidence in vaccinations.
It kind of gave the message to the anti-vaxxers that they were supported. Samoa is a beautiful group of islands. It's made up of two main islands. That's Manono Island and that's Apolima Island.
Leilani Jackson is on her way to one of Samoa's largest islands, reflecting on a moment in her country's history that shook her and the people she loves to the core.
The death toll has skyrocketed to more than 50 people, many of whom are children. More than 1,100 people have been admitted to the hospital since the outbreak began in late October.
I saw what a whole society being ravaged by measles will look like, and it's not pretty.
It was chaos. I feel like a bit of disbelief that it was happening at this time and age and in Samoa.
As a nurse, Leilani has spent her career helping small South Pacific island nations get their citizens vaccinated against preventable diseases. When the measles outbreak struck in Samoa in 2019, her darkest fear turned into reality. When that first case of measles outbreak was reported, what was going through your mind?
Utter disbelief and
Years later, the pain still there.
Just pure shock and sadness. I think that's why I get very emotional when I think back about the lives that were lost and the grief that Samoa went through, and I'm sure are going through for some families at the moment.
Before the measles outbreak caught fire across the island, before thousands were infected, Leilani and other public health officials say something else was spreading across Samoa at the time: misinformation, impacting trust on the one thing that could have prevented the crisis. Many point to one man, Robert F. Kennedy Jr.
I went there, nothing to do with vaccines.
He's trying now to play down his role in Samoa.
You scared people from taking a vaccine, and children died.
Remember what happened a year before the outbreak? 2 Samoan infants died after receiving a deadly mix of the MMR vaccine and expired muscle relaxant. The 2 nurses who administered the botched shots sent to prison. 33 days after their deaths, an organization Kennedy founded, now called Children's Health Defense, paid Facebook to post an ad. According to research conducted by George Washington University, shared exclusively with Atlanta News First Investigates, the ad wrote, "Routine measles vaccination has worrisome consequences," claiming the rise of chronic childhood illnesses disproportionately observed in vaccinated children is linked to elevated cancer risks. Kennedy's organization paid for 2 more similar ads on Facebook shortly after. One post linked an article falsely claiming the MMR vaccine is tied to autism. Most of the ads cost between $100 and $499 each, reached up to 110,000 people combined, and all of the ads specifically targeted to female Facebook users.
From my standpoint, should rot in hell for this, because he knew he was taking advantage of vulnerable people.
Mothers like Fa'aoso Tulivale say they remember seeing social media posts about the infants' deaths and vaccine skepticism before the outbreak that killed 3 of her children.
Many people, including some of our own family, claimed vaccinations weren't safe, saying traditional Samoan food was enough. I followed their advice, but now I realize they were wrong.
It absolutely killed children. It devastated public confidence in vaccinations, and the MMR vaccine has saved hundreds of millions of people. It saves people's lives.
According to the George Washington University study, the majority of Facebook ads that spread vaccine misinformation before Samoa's outbreak were funded by 2 organizations run by well-known anti-vaccination activists. One of them, the organization Kennedy founded. I'm gonna go see if I can find him. Here's what he told a group of Texas parents about the MMR vaccine in 2019.
The thing that cured it was nutrition and clean water, not the vaccine.
About 6 months before the outbreak, Kennedy visited Samoa in person. One of its newspapers covered him and his wife, actress Cheryl Hines, as visiting American dignitaries, posting pictures with the Prime Minister. Kennedy also posed with this woman, Taylor Winterstein, a Samoan social media influencer, well known for her anti-vaxxer messaging in Australia. She wrote in her post, "I am deeply honored to have been in the presence of a man I believe is, can, and will change the course of history."
It kind of gave the message to the anti-vaxxers that they were supported. His presence in Samoa was significant for the anti-vaxxers to push their message through.
Kennedy says his trip was organized by Edwin Tamasese, a longtime vaccine skeptic on the island. Samoan authorities arrested him for allegedly trying to convince people not to get the MMR vaccine during the country's mass vaccination campaign. He wrote on social media, "I'll be here to mop up your mess. Enjoy your killing spree."
This small population, 1-2 deaths is a disaster already.
Dr. Taki Nasari was Director General of Samoa's Public Health Services during the epidemic. What do you think about his arrest?
It was good. It was a hindrance to the progress of the measles response, especially when children are dying.
Kennedy called Edwin a medical freedom hero after his charges were later dismissed.
A little alcohol to clean the area.
When the outbreak started, Kennedy did not stop spreading doubt about the MMR vaccine. He doubled down. And in this letter to the Prime Minister on November 19, 2019, he wrote, "It is a regrettable possibility that these children are causalities of the MMR vaccine." The letter sent 4 days after the Samoan government issued a state of emergency. 16 people were already dead.
But what went through my mind was, what an asshole for making such a statement, especially for a country like Samoa, which is still developing its services. So I thought he was such a selfish man who has at his fingertips everything available to him to live longer, and creating such confusion and doubts in Samoan minds about vaccine and getting vaccinated.
Clearly, I had nothing to do with the measles.
Kennedy responds about his alleged role in Samoa.
You launched the idea that a measles vaccine caused these deaths.
And the potential impact to public health in the U.S. and across the world.
I worry about the next infectious outbreak of something that has a high mortality associated with it.
More than 3 months after measles exploded in Samoa in 2019.
Okay, no measles for sure. Okay, thank you very much.
The country's deadly epidemic came to an end.
Health officials confirmed no additional deaths in the past 48 hours. That's a major milestone as the country continues its mass vaccination campaign.
Despite the vaccine's success, public health officials say Robert F. Kennedy Jr. continues to sow doubt about what happened in Samoa and the MMR vaccine nearly 6 years later. He declined multiple requests from Atlanta News First Investigates for an interview.
Good morning. This hearing will come to order.
But he did respond to lawmakers during his confirmation hearing in January.
Just look at what happened when Mr. Kennedy inserted himself into an anti-vaccination crisis in the island nation of Samoa. In the end, 83 Samoans died, mostly kids.
I never gave any public statement about vaccines. You cannot find a single Samoan who will say, I didn't get a vaccine because of Bobby Kennedy. When the tissue samples were sent to New Zealand, most of those people did not have measles. We don't know what was killing them.
Not true, says Samoan public health officials past and present. What killed the children in Samoa in 2019?
It's the measles. It's a measles outbreak. We also had a forensic pathology team that came at the time and confirmed that they died of measles. But the vaccines did not kill the children. It was the measles virus.
Measles killed the children. I mean, yeah, it's pure and simple. It was measles.
Do you accept even a sliver of responsibility for the drop in vaccinations and the subsequent deaths of more than 70 people? Anything you do differently?
No, absolutely not.
Since confirmed as the nation's chief public health official, Kennedy fired all 17 members of the Advisory Committee on Immunization Practices at the CDC. They wield enormous power shaping vaccine policy and what's covered by Medicaid. One of his new appointees,
removing a known neurotoxin.
Lynn Redwood, the former president of Children's Health Defense, the same organization founded by Kennedy that has spread measles misinformation for decades, according to public health officials.
Vaccines work. We know from clear and compelling evidence that
Dr. Peter Marks was the nation's former top vaccine official at the Food and Drug Administration, who says he was forced to resign after Kennedy's confirmation.
What I worry about now is we've gone even further in the wrong direction, where I worry about the next infectious outbreak of something that has a high mortality associated with it. Will we be able to convince people to take a vaccine?
Dr. Marks and his colleagues in public health are concerned about the ripple effect of Kennedy's mixed messaging about the MMR vaccine.
I'm going to tell the truth about everything we know and we don't know about vaccines.
Are you recommending the measles vaccine?
I am not going to just tell people everything is safe and effective if I know that there's issues.
It's dangerous. I trust in the vaccine. And with an influential person like him in that, holding that high position, it seems most people will believe him.
No more. It's over. It's going back in the box.
Mariana Slaughter says families like hers in Georgia feel heard by Kennedy. None of her children are vaccinated, and she believes their numbers are growing.
You will be shocked. That's all I have to say. I know plenty of people whose children are fully vaccinated. I know a whole lot more people whose children are partially vaccinated or completely unvaccinated.
What can people in Georgia, the United States, learn from what happened in Samoa?
Vaccine saves lives, and science has proven this.
I just don't want anyone to feel what I feel when it comes to measles in Samoa.
Hi, Daddy. Hi.
So please, I'm asking please, keep on accepting the vaccination.
A warning from someone who knows the tragic consequences of misinformation. If vaccine rates continue to decline in the U.S. just 10% more, Stanford University researchers estimate 11 million people will contract the measles in the next 25 years. To watch more of our conversations with these Samoan families and health experts, go to this story on AtlantaNewsFirst.com for extended interviews. While there, listen to our podcast as we take you behind the investigation, explaining what compelled us to tell this story and the obstacles along the way. Thanks for watching Atlanta News First Investigates.